Okay, short video about carotid artery disease, just so we can get on with the discussions. Um, so, carotid artery disease is one of those things that the management has changed over time. When I first started 29 years ago, I think I was much more aggressive about managing it surgically, but I've become less and less aggressive as new data has come out on it. Back then, we had that 2000. I can't remember which year it was actually. I'm sorry, it was in 2000. There was a publication in the New England Journal that essentially looked at carotid artery disease and carotid endarterectomy or intervention. Carotid endarterectomy being cleaning out the artery versus intervention, and suggested that anybody over 60% stenosis or narrowing of the artery needed to have it repaired. And so, that kind of influenced us at an early age to be more aggressive. But I think as time has gone on, we've become far less aggressive about it because the natural history doesn't seem to be as bad as we were worried about. So anyway, what are the carotid arteries? The carotid arteries are the main blood supply to the brain. There's really four main blood vessels that supply to the brain. The carotid arteries are the ones underneath these muscles here, the sternocleidomastoid muscle. They run deep to that muscle, and there's two of them, obviously one in each side. The left one supplies the left side of the brain, right side supplies the right side of the brain. And so just like any other artery that has blockages, there's certain risk factors for it, the usual six. The same thing for PAD or heart problems, the same six risk factors: age, cigarette smoking, high blood pressure, high blood sugar, cholesterol, family history, circulation problems. Those are the main six. And so, age and family history, I'm sorry you're stuck with. But blood pressure, cholesterol, blood sugar control is really important. And then not smoking cigarettes, not just for the carotid arteries, but for heart artery blockages and leg artery blockages. So those are all the risk factors for it. Most people who have hardening of their neck arteries or their carotid arteries don't really know they have any issues with it unless they have a testing done for some other reason. So the carotid arteries supply the front of the brain, and then there's the vertebral arteries that come off the arm arteries that supply the back of the brain. So that's the main blood supply to the brain, and there's connections inside the brain between those two systems. But I think it's fair enough to say that the carotid arteries are probably the most important one, although the vertebral artery problems can be an issue. So the carotid arteries, the left side supplies the left side of the brain, right side supplies the right side of the brain. Just because you have carotid artery hardening doesn't mean you need surgical fixes, right? Just like anything else. What's the words, what's the numbers, and what's the short and long-term implications of having a procedure done? So that's the decision-making process that's involved in managing carotid artery disease. And in terms of the kind of the numbers you look at, most people start talking about or thinking about surgery when you get to the 70-80% range. But again, those things are changing with some of the drugs that we have available, some of the treatments, the blood thinning medicines like Plavix. So there's some flux in terms of management. But I think it's fair enough to say that just because you have carotid artery blockages doesn't mean you need surgery. Like, for example, some of the considerations are, if you're like 85 years old and you have a 70% carotid artery blockage, is it worth the risk of having a surgery done? It just kind of goes to that factor of consideration that, how much benefit are we going to give an 80, 85-year-old person with a 70% carotid artery blockage by cleaning them out? How many carotid surgeries do we have to do to help an 80-year-old man reduce his risk for surgery? I.e., do we have to do 1,000 carotid surgeries before we save one stroke? And, those are the questions that I think that we need to really think about before we suggest surgical treatments for carotid artery disease. It's that whole convex concave lens that Nassim Taleb talks about in terms of decision making. Here's the risk factors coming in, here's the problem. Is there a huge improvement in outcome or reduced risk for stroke with carotid surgery. And, you have to take this into consideration, not just in the short run, but in the long run. What's going to happen in the long run? Are we going to save a stroke for a year or two and the patient dies of heart disease? So, is there a tremendous benefit to having surgery? But anyway, so often I see patients for carotid disease, they're referred because they have a test for an incidental finding. They have an x-ray of the neck and they got calcifications in their neck arteries. So they come in really worried about it. Obviously, it makes sense, right? You don't expect calcification in your neck artery. But what I tell people is, look, you can have, so think of this as a three-dimensional structure, right? It's a plumbing, right? It's a tube. And so this three-dimensional structure of it, when you take an x-ray, you see calcification in the wall. It's a two-dimensional structure. But a three-dimensional structure has a orifice in it. And so is that orifice narrowed by the hardening of the artery? Remember, the artery has 3 layers to it, and you can get calcium buildup in the artery itself. But is that internal lumen wide open? And that's where a duplex scan, carotid Doppler, will show you if there's plaque buildup inside the lumen. It can be on the wall of the artery, but as long as it doesn't impinge on the lumen, the part the flow goes through, then it's not a big deal. So carotid Doppler will show you if there's narrowing in that artery, and then you can kind of go from there. But generally speaking, most people who have carotid Dopplers don't really need anything done because their narrowing is not severe and needs to be monitored. So if I see a patient with this kind of diagnosis of calcification in the carotid artery, I'll talk to them about the history and do the history and physical examination, and then maybe do a carotid Doppler to check it out to make sure it's not really narrowed. Most of the time it's not and does not need treatment. So what are the signs and symptoms of carotid artery disease? Well, most people who have significant carotid artery narrowing don't know they have it. It's discovered incidentally for other reasons. Like, I'll be examining a patient, hear a harsh, what's called a bruit, a sound in the neck. And so if we hear a bruit, we're more worried about it. Why? Because it's a vibration. So that suggests there's a narrowing. Not always, but that suggests there's a narrowing. And that needs to be checked out with a carotid Doppler. We do a carotid Doppler. I'll tell you, my impression is that ladies who have these bruits tend to not have anything significant in terms of narrowing. It's probably something related to the structure of women's carotid arteries and maybe the tortuosity that they have, that you hear these vibrations and they really don't mean a whole hell of a lot. But we'll do a carotid Doppler on them. And if they've got narrowing, then we'll decide whether they need treatment or not. Most of the time, they do not need treatment. The symptoms of carotid artery disease are referable to the side of the lesion. So like I said, most people who have carotid disease don't know they have it, and it's not symptomatic, and they don't need treatment, okay? But should you have a symptom of carotid disease, typically it's not the dizziness kind of stuff. It's actually stroke type symptoms. There's no pain associated with it. It's like, I don't get this arm pain or neck pain that goes down my arm typically, unless there's a dissection, which we can talk about later. But so the typical symptoms of carotid disease are, let's say I'm right-handed, which I'm not, I'm left-handed. But if I'm right-handed, if I have a left neck artery blockage, then the symptoms I might get is symptoms referable to something breaking off from my neck artery and going up to my brain on that side. And the symptoms will be fairly specific, like I'm certain cup of coffee in my right hand, all of a sudden can't move my arm at all. No pain associated with it. It's a drop, it's a loss of motion, or my right leg stops working. It's not like, you wake up one morning and you've slept funny and your arm isn't moving, you recover pretty quickly. It's pretty profound. If you ever have it happen, it's pretty profound. Can't move my arm or leg at all, okay? So that's one. And then the other symptom you can get is what's called amaurosis fugax. I'm reading a paper, all of a sudden a black curtain comes down over my eye. I usually tell my older patients, you remember those old movie theaters where the curtain would come down? That's what it kind of looks like. So a curtain comes down over your eye, kind of lasts, minute, 5 minutes, or hours. That's amaurosis fugax. That's amaurosis fugax meaning loss of vision, temporary loss of vision. So that's amaurosis fugax. Or, most people who are right-handed have their speech center on the left side of their brain. So they'll be, for example, talking fine, next minute will come out nonsense. They'll want to say apples, oranges, pears, and they'll say garden salad or something like that. Or they won't have the ability to speak. They'll know what they want to say, or they can't say it, or it comes out nonsense. It's not like I can't remember a word. It's more like a profound inability to speak at all. So you can have what's called a TIA or a full-blown stroke. The TIA is where you have recovery function within 24 hours. It's essentially a stroke, but it's a small stroke, so you recover function within 24 hours. And a full-blown stroke is where you don't recover function within 24 hours. And so there's different nuances to that. But, we don't know if you have carotid artery disease and you have significant narrowing, which one it's going to occur, the TIA or the stroke. We just know if you've had a TIA and you recover function within 24 hours, your risk for stroke really starts going up high. So if you're asymptomatic, your risk of stroke is actually fairly low. If you have a TIA, the risk really goes up exponentially. So that's that a TIA with significant carotid disease really needs to be treated interventional-wise. And we'll kind of get more into the interventions, but that's the issue with neck artery hardening or carotid artery disease we need to talk about. But again, I stress, this is a systemic disease, okay? So if you have carotid artery disease, you have about 2 to 3% chance of having significant coronary disease, heart blockages. And so when I see people for either peripheral vascular disease or, carotid artery disease or any type of arterial issue, I always ask them the same issues. Are you having loss of vision one eye versus the other? Can't speak at all, can't move an arm or leg, chest pain, shortness of breath, difficulty walking distances, difficulty wound healing. Those are all kind of tied together in terms of arterial disease. Next time we'll get more specific about carotid artery disease and management. But obviously risk factor modification is really important. You gotta try and get off the cigarettes, blood pressure, cholesterol, blood sugar control, and exercise regularly. Anyway, next time we'll talk about the other stuff. And by the way, no, I'm not advertising Inwood Bank. A friend of mine just gave me these shirts and I just love them. They're so comfortable.